Hi, this is Shona Craig. I'm a physical therapist at Therapy Solutions and a Vodder trained therapist. So I'd like to discuss with you how to do your own dry brushing for manual lymph drainage for when you have had a unilateral mastectomy or have had lymph nodes removed from one of your armpits. So when you have lymph nodes removed from an armpit, your lymph system has been changed, so we'll want to use alternate drainage pathways for your dry brushing. So to start, I recommend starting with diaphragmatic breathing to calm your nervous system. So you can start with 10 deep breaths or just lay down and breathe for a minute. And then find a dry brush. So these are the ones that we sell at Therapy Solutions, which is nice because you can slip your hand right in. And you're going to start at your neck. So for each area, I'd say do at least 3 strokes per area. The longer time you spend, the better. So start at your collarbones, because here is where most of your lymph drains back to, these big veins here above your collarbones. And then you'll do the sides of your neck, so sweeping downwards towards your collarbones. And then you'll sweep the back of your neck. Okay. And then you'll come towards your uninvolved armpit. So let's pretend that I've had lymph nodes removed from my right armpit. So you're gonna just do circles around your left armpit. So we're just preparing this area to take in some of the fluid. Okay. And then you'll brush your uninvolved breast. So I'm just gonna brush my left breast towards my left armpit. I'm kind of sweeping around the nipple area and just brushing all around the breast up towards the armpit. Okay. And then I'm going to sweep across my chest. So this is one of the alternate drainage pathways from your right armpit towards your left. Cross several times, and then you want to go below your breast, so your scars, several times towards the left. Okay, and then another alternate pathway fluid can take on this right side is down to your groin. So then you'll do circles over your groin, clear that area. Okay. And then you'll brush down towards your groin. So on your side, you can start kind of under the scar here if you've had a mastectomy, and then really get up and under the armpit like this. Okay. And then if you have if you can reach, or if you have a brush with a handle, you can also brush around your back. A nice way to get some of that swelling that accumulates under the armpit. And then for your arm, you'll start with the upper arm. And you want to sweep from inside out and up and over your shoulder, up and over the deltoid. This is the alternate pathway for the arm. So because you have a roadblock in the armpit, the arm usually drains to the armpit, but now we're taking the alternate pathway up and over your deltoid to your collar, to the vein above your collarbone. So then you can do some circles over your elbow, and then you can go to the lower arm, same thing, inside out and up, and then you can come to your hand and just sweep a couple times over the hand. Just kind of do a few long strokes up the whole arm, just like that. So that is dry brushing for when you have lymph nodes removed from under one armpit. Everyone has a different system, so make sure you check in with your doctor or your lymphedema therapist to figure out which pathways would be best for you to use. All right, thanks so much for watching.